Your sister is jumping hurdles. Suddenly, she misses a step, falls, and what would you do? Luckily, an acronym can help you. DRSABCD consists of the words and phrases danger, response, send for help, airway, breathing, CPR, and defibrillation. It gives you a process so that you know exactly what to do. The first step in DRSABCD is to look for any danger in the area. This could be danger to the casualty, yourself, or any other person at the site. This step can avoid further harm to the casualty and anybody else. The second step is to detect a response from the casualty, following a procedure called COWS. These questions work for casualties who can or cannot talk. This is important to indicate the consciousness of the patient, so that you know what to do next. If the patient is conscious, manage the bleeding and call an ambulance. If not, put the patient in the recovery position. The third procedure in DRSABCD is to send for help. You may call 000 for an ambulance or ask somebody else to make the call. It is important that only one person is given the task of calling, because otherwise a large group will crowd around the telephone and have not much to do. Always remember that to stay organized is vital in these first aid situations. The fourth step is to check the casualty's airway. Tilt the patient's head backwards and open his or her mouth. Clear the airway and remove any foreign objects. Foreign objects and fluids that could be of risk to airways include anything from water, blood, to an object the casualty has swallowed. Make sure to check for signs of life. The fifth procedure is to check for breathing, a fundamental process that ensures survival. If there is no breathing, go to step 6. If the casualty is breathing, put them in a stable recovery position, with one hand under the chin to keep the mouth open and another arm and knee on the same side to support position. Somebody has to monitor the casualty. The sixth step is to start CPR if there are no signs of life from the casualty. CPR stands for cardiopulmonary resuscitation. First, give 2 initial breaths before starting compressions. To give compressions, put 2 hands over the chest and push down firmly. This is 1 compression. Give 30 compressions followed by 2 breaths, and 2 compressions every second. Repeat until the patient is breathing or help arrives. The seventh and last procedure is to attach a defibrillator to the patient as soon as possible. It is extremely helpful as it sends electric shocks to the casualty to trigger a heartbeat. It will continue to do so until a heartbeat is detected. With DRSABCD, your sister will be jumping hurdles again in no time. Thank you for watching.